Hi, I'm Paul Silovsky, physical therapist and owner of Rebound Physical Therapy, and today I'm here to talk to you about how poor posture can or does cause you chronic pain. So many of the patients that come to us have chronic pain that stems from largely poor posture or poor postural alignment. Certainly can exacerbate your pain or make it worse. So you could say that your mother was probably right when she said you should sit up straight. Let's get into why and what that really means. So what is good posture in the first place? Good posture is also known as a neutral spine. Neutral meaning that there's a natural S curve to the spine, a slight S curve, meaning a mild curve in the neck area, a mild curve in the upper back, and then another mild curve in the lumbar spine. And those should be balanced out so that the muscles and the support structures or the bony structures of the spine are equally supported, that there's not too much strain in one direction or the other. Now, another dynamic part of postural alignment, particularly around the spine, is that we move in 3 dimensions. And what I mean by that, so we move from the front to the back, so there's a plane of motion that goes this way. We move side to side, plane of motion that goes this way, and then we also move rotationally. You can be off in any direction. So when I say neutral, I'm talking about planes of motion or mobility in the world in which we live that needs to be within a certain healthy range. So now, looking at good posture from the viewpoint of a physical therapist and sending that on to you or communicating that on to you in layman's terms, let's talk about it real briefly in standing, sitting, and lying down. So in standing, good posture would be good alignment from the side here, from the head or the earlobe down to the chin, to the hip bone, knee bone, right on down to the foot and ankle area. In other words, you'd have pretty straight alignment when we're looking from that angle, and we'd have those curves that I was talking about before, natural curves. You wouldn't have, you wouldn't be too far forward with the head and shoulders or the rounded upper back. You also wouldn't have what's called a sway posture where the hips would be pushed way forward. And a lot of times you'll see people in that condition, they don't have very strong gluteals or very good structure in what I call the big house back there. You want to have nice, strong, balanced hips to support the spine and the rest of the body. So in a standing posture, you just want that good neutral alignment that we talked about. In sitting, we're thinking more about 90-degree angles. So if I was, I'm not sitting right now, but if I was sitting at a chair here, my wrists and elbows would be at a 90-degree angle, my head would be upright, my visual field would be straight ahead with my monitor, let's say if I was looking at my desktop or an elevated laptop. And then the same is true with my hips, my hip angle. My hips would be at 90 degrees, and then my knees would bend down at 90 degrees to the floor with my feet supported if I needed it. If I wasn't long-legged like I am, I might need some support so my feet aren't dangling. But my point is that we're working in 90-degree angles to support the spine and hold it in that neutral position. And then when it comes to lying down, again, mild curves are fine. You don't want extreme curves. People get the pain in their neck from sleeping with too much of a pillow or not enough of a pillow to support that spine neutrally. In other words, a mild curve in the neck, in the lumbar spine, and then of course supported hips and knees as needed to hold yourself in neutral and find the position that your body likes or loves to be in. But most commonly, it's that neutral spine that we're looking for and defining as good posture. Now, how do physical therapists treat poor posture? The chronic pain comes from the chronic stress or strain on the muscles and the tendons, the ligaments that support the spine, and even the bony structures can wear over time. If I was in an excessive forward posture here, or had a sloppy posture in the low back, I could compress those vertebrae and actually cause structural changes in the bony elements too, not just the muscles and the tendons and the ligaments. Now, first things first is we get you in a nice upright posture, upright alignment. We also work on any muscle imbalances. I'll use the example of the forward shoulders. If I had tightness in my chest muscles here, I would need to stretch those out, and meanwhile strengthen the upper back muscles as well as the abdominal muscles to hold myself upright. Postural muscles take a lot of endurance, and we're not necessarily talking about brute strength here like lifting heavy weights, but those postural, or what we call intrinsic muscles, those muscles close to the spine, really need to be able to become active and activated and work efficiently. So when things get stretched out, you get weak if a muscle gets overstretched. You can also get weak if a muscle's too short. You want to get those muscles working in their optimal ranges, and you want to turn those muscles on frequently. One of the things I'll tell people about postural improvement, let's say someone, if I just wanted to cue someone to lengthen their abdominal muscles to be more upright and maintain a more relaxed posture or position in sitting. If I just got myself more upright a couple hundred times a day, I would be engaging some of the muscles in my lower spine and in my abdominals to hold myself upright, and then I'll also be turning on muscles in my neck and shoulders and upper back to hold myself more upright. And of course, I would fatigue and I'd fall back into it. But every time I do a repetition, it takes the endurance and the awareness to increase that. So that's what we do, is we increase the awareness of not only the positions to put yourself in, but the muscles that you need to stretch and strengthen in order to maintain a more ideal posture for you, so that you don't have that chronic strain, the chronic pain on the soft tissues and the joints, because that is what happens over time, and that becomes very uncomfortable for us. So look, there's always something that can be done about improving our posture. Gravity does win over time. We are fighting a battle against the push and pull of gravity and the different movements that we do throughout the day that pull us one direction over another. So corrective exercise allows you to exercise in any way that you want to, but it also then gives you that relief so that you don't have those chronic painful conditions. So if you want to know more about that, give us a call. We're happy to help you out and do an evaluation of your posture and put you on a postural improvement program today.